Welcome to this episode of the Horton Hangout. Thank you so much for joining us. I am here, as always, with my co-presenter, Leanna Best.
Hi. What have you been up to then, Laura?
Spending a lot of time with you.
You have.
Isn't it nice?
It is nice.
It's really nice. We had a fantastic time last week in Scotland.
We did.
That was lovely.
Beautiful.
Also, great decision to get the earlier flight up there.
Yes.
Really good.
Yeah.
So that we always travel the day before anyway. But we both got up there for lunchtime, so we got to spend all that extra time together because
really productive.
You're Bristol, I'm Essex, we've got teams, but actually the more we meet up, the better things are for us.
I agree.
We're people persons. That's the right saying.
Yeah, people.
Yeah.
I think it was a really good event because it was the two practices together and they're really looking on transforming their TCO-led experience, which I love. That's obviously what we're really passionate about. And what I loved was the engagement because especially having two separate practices, one, how do they, work with each other?
Yeah.
But it was just complete ease. It was synergy there, such engagement, and they were asking really great questions.
Yeah.
They were on board. So for me, and I know for you as well, afterwards we had a great catch up. We really enjoyed it.
Yeah. It's the leadership.
Yeah.
The leadership for those businesses is strong and it's a husband and wife team and the leadership's strong. And that's why the day was so great because the communication to that point had, I assume, been at a really high level. I shouldn't assume, I know.
Yeah.
And it was a really big part of their business plan that they're rolling out and it was great. It was really exciting.
And what I love about that husband and wife team is I can tell there's no micromanagement, which is really healthy. Difficult to achieve, but really healthy.
Yeah.
And the teams were I just thought they were great.
And the reason that we did that event together is because there was so much content to share in the day. And if it was just one of us, it would have been really heavy going. There was that much
So
to get
heavy.
across. Actually, if it was just one of us, it would have been probably a 2-day event to get that level of content over. And it's really nice for the teams to have two presenters to be looking at because otherwise, as we know, when you're experiencing a training day and you're looking at the same person all day, it's tiring anyway. We're used to being in practice.
Yeah.
We're used to be running around like headless chickens as, dental nurses in particular. So then sitting and attending a training day can actually be quite difficult. But we never have people that fall asleep on us. Never.
No, we don't.
Never. It's
The energy's
engaging and
high.
fun.
Yeah, I love it. It's nice. It was a great, great day.
So this is the first pod. Let's talk about how our careers in dentistry started.
Yep.
Dental nursing. Now, I feel we know each other very well. We've known each other a very long time. I don't know if I know the answer to this question.
Okay, go.
Right? And I might, as you're telling me the story, go, oh, yes.
Okay.
But let's see. So how did you get into dental nursing?
Okay. I was taking a year out. I was very firm I wanted to be a nurse. And that was it was teacher or nurse. And then I decided nurse is my preference. So I decided to take a year out after sixth form and work in a salon. I was already working there anyway on like a Saturday. So I decided that I'll make some money, save up, and then I'll go to uni. My dad hated that idea. No, you're not going to go. Yes, I am. I know I am. And we had two clients, or my sister had two clients because she was the beautician in that salon and built up a really good relationship with them, knew them really well. And Debbie, who I even love now, she said, I think you'd be really good at a dental nurse role. And I thought, I don't know anything about it. So she invited me in to go and shadow for the day to see if I liked it. Went in, and because I didn't really have any preconceived ideas of it, normally I get quite nervous with new things, but I didn't. So went in and I was shadowing the dental nurse that was working with Ian, and that was Lisa, who again was the other person that was a client of my sister's. So I had a great relationship with her. She's amazing. I loved it. And you know why I loved it? They took an amalgam filling out and did a composite. I basically was in the patient's mouth. wow, I'm enthusiastic. I was going for it. Well, that's amazing. And he would, design it all. Even back then, I was 19. And he was so great at the art around the composite filling. It wasn't just plonked in. He would make the cusps and everything, and I was just sold straight away. So then they said, it was a really informal interview with Ian and David, who still have a practice now, Coronation Road, and they offered me the position as a trainee dental nurse. And they were amazing. Honestly, I don't think if I didn't want to progress, because there wasn't a progression opportunity there apart from everything I had done, I would never have left.
Oh.
Ian and David and everyone there, because they still have pretty much the same team that's just grown.
Wow.
Nobody's really left. Koo, obviously my best friend, who I've always worked with, she worked there. They're just the best. They're very happy to mentor you. It was a mixed NHS and private practice, very family feel. I just could sing their praises all day, every day. Honestly, I love them. I think they're great.
Amazing.
Yeah.
I don't think you had told me that story.
Yeah. And then I remember when I left, I wanted to do orthodontic therapy.
Yes.
And I'd gone and had an interview, which I felt quite horrible doing that behind their back. I wanted to tell them, but I felt like it was inappropriate to tell them. So it was a difficult one to juggle. So I got the job and was very open in my interview and said, that's my end game here. And they said, yeah, that's definitely something we'll be able to offer you in the future. So I was moving over to an orthodontic practice in order to become an orthodontic therapist. But when I told Ian, he was so sad. He was so sad. Oh, I hated it. And he, came up to me and he was like, is there anything I can do? Can you not stay here for a bit of the time? And then we'll speak to another orthodontist who we used to have a referral relationship with. And maybe he can help you achieve that, but you can stay here at the same time. Oh, love him,
How
Ian.
sweet.
But then I didn't. And I would say that was a mistake I made. I should have not done that because it was an awful practice. I think I was there 5 months, in and out, gone. And it was all a lie. There was no opportunity for me to progress in that way at all. The culture there was not great. And I was quite nervous most days because of the personalities there and the way in which people would communicate. It was all very toxic. So that wasn't nice. And then I went to work for Richard, who used to refer from Coronation Road to him for orthodontics. And I love him as well. He's an amazing man. Worked with him for a few years. Just very amazing man in terms of how he speaks to patient. I think the way his communication is with patients is amazing. And, not long ago when I was still working in Clifton, I'd bumped into him and it was a keeping in touch day. And I was going to get myself a coffee. And I was like, Richard. And he was, oh, hello, Lee. And then we sat down and had a coffee together.
Lovely.
So I've been really lucky, actually, with where I've worked, bar one place, which was, in and out. I've been able to have really wonderful experiences in my career. And I did my radiography with Richard. So that was nice. We used to make retainers and everything, and he's a very calm man. Yeah. Champions you going on and doing extra and progression. Just lovely. Really lovely. And again, very family feel.
Yeah, yeah.
And then I went to Clifton Dental Studio where you met me.
Which is where we met.
But that's where things really took a change in terms of my learning. I think I was kind of coaxed in before that, thinking I'm learning. Obviously, I learned loads in, the orthodontics, and I actually love ortho. I think that's my favourite. But I'll never forget that first day I nursed with Neil. The amount of instruments on the side. I said, sorry, what's happening here? And they're like, oh, we're going to do a crown prep. I said, sorry, what's all this extra stuff? And they said, oh, don't worry, you'll see. And I was floored. I could not believe the amount that goes into, the one crown prep that I was so used to seeing before.
Yeah. But
I learned so much. I wouldn't know what I know today without Neil.
Yeah. Fantastic experience.
Yeah, unbelievable.
Yeah. And we'll come back to that for sure.
Yeah.
This summer, it will be 17 years that I set up Horton Consulting, first of all, Laura Horton Consulting. And in that time, I cannot tell you how many practices that I've been into and how many teams I've helped with their communication. And one of the things that I always help practices with is words in particular they shouldn't say. And I call them banned words. They are as simple as that, and they're on a document. So throughout this pod season, we are going to share with you banned words and alternatives to use to really help you elevate your communication skills in your practice.
Okay, so Laura, banned words. What would you say is the most common banned words used within clinic?
Good one.
Good one.
It's probably really obvious. Surgery.
Yeah.
And I always welcome teams to open up their minds and just think about that word. Surgery.
Horrible.
Horrible. No one wants surgery. Why are we inviting someone?
Surgery.
Why are we can't jazz it up.
No.
Surgery.
Yeah.
Come into the surgery. And it's a terrible, terrible word.
Yeah.
And I understand that BDS is Bachelor of Dental Surgery. I understand that. But using the word surgery on a door and inviting people into a surgery is an absolute no for me. It's got too many negative connotations with it.
Yeah.
I also have experienced a lot of practices rebranding their name and, Horton Dental Surgery just to Horton Dental or Horton Dental Clinic or Horton Dental Practice, and having surgery in the name as well. It's very retro. It's very sort of 80s, isn't it? I was once in a practice going through this, and I distinctively remember the practice. I know who the dentist, the owner was, but I won't say his name on here. And it was like a comedy scene because we're going through the banned words. I'd only got into a couple, and surgery being number one. And on every door was a sign that said surgery.
Oh, gosh.
And we wondered, what is he doing? And he'd actually got out his toolbox.
Taking it off. Well, he was so invested, though. Good for him.
He was like, well, I've never thought of this before. And all the team was sat there like, oh, my gosh, what are we doing? Using the word surgery. When something's just normal, it's fine. Like, it's just what everyone rolls with. So for me, it's a treatment room.
Yeah.
Now, the last practice I worked in as an employee, we were called the Perfect Smile Studios. So we'd call the room a studio, and you were Clifton Dental Studio. So you called it a studio as well. The word surgery is not something that's been in my vocab for a couple of decades or more.
Yeah.
So I think it's just a word that's really, really negative. It's got negative connotations. And particularly if you're dealing with nervous or anxious patients, it's just something that just needs to be taken out.
Yeah, it's not positive, is it?
No, not at all.
When you see the word surgery written anywhere, you assume that you're going to be cut open.
Yeah.
Is the truth of it.
Yeah. Yeah, I don't want a general anaesthetic.
No.
And I don't want a scalpel blade coming anywhere near me. Thank you very much.
Thank you.
Yeah.
So, yeah, great.
Yeah. What about you?
A banned word that I find is often used is bleaching.
Oh,
I can't bear it.
God.
I couldn't bear it before it was presented to me as a banned word anyway. It's quite cheap, isn't it?
Yeah.
I
mean, I do not want easy 79p bleach from Tesco's going in my mouth.
No. Bleach is for the toilet and to clean surfaces, to get germs, to kill germs. I don't want it on my teeth.
Cannot bear the word bleach.
No.
Bleach or bleaching. No. That's a no for me. I mean, that's like you say, it's what I put down my toilet.
Yeah.
That's what I clean my sink with. I mean,
Yeah.
I love bleach for cleaning.
Yeah.
Even this morning, my husband was like, "I can smell bleach," and I'm like,
I hate it
love
anyway.
Oh, I love this. But who wants to put bleach in their mouth?
No.
Why are we saying, yeah, we can bleach your teeth? No, that doesn't land
Again,
at all.
It's quite retro again, though, isn't it?
Yeah.
We just conform.
Yeah, because I'm pretty sure, and someone can correct me if I'm wrong, that is the clinical term for lightening a patient's teeth, or lightening patient's teeth is bleaching. I'm pretty sure that's like maybe the clinical term. I think that's where that word's come from and got stuck.
Makes sense though, because the shade guide BL1,
The
bleach shades.
Yeah.
So
that's the problem with dentistry. We get these words stuck in our head.
Yeah.
I've got a question for you.
Go.
So when I came into your practice,
Yes.
and then I was obviously doing a lot of communication skills, vocabulary. How did you feel when banned words were first presented to you?
I don't know. I'm quite a keen learner, so I was a bit shocked and a bit concerned that will I remember everything? So more wanting to perform my best. That was kind of my mindset.
Yeah.
But I know you do get some resistance when you present banned words.
Yeah.
Because it's like unteaching yourself everything that you already say.
Yeah.
Cancellation's a really difficult one for front of house.
Yeah.
Because it's so normal for them to use that word that when we change it to opportunity, it's so different that it's difficult to pin down and to get it to stick. But I think they need to see the value in it. That's where I feel that banned words can change to a positive outlook is when you understand the difference between the like positive language and negative language.
Absolutely. So we're going to talk more about banned words in every episode.
Brilliant.
Your experience is really, great for you to share. But I think let's just touch on this cancellation word, because cancellation is a banned word for me as well. And the reason for that is that by using it, we are saying it's an acceptable word to be used in our practice. Therefore, our patients can use that word and also carry out the action of that word. We do not want patients cancelling appointments. And I'm not talking about, I've just realised I've got an appointment booked for August and I know it's June, but I need to move it because I've just booked a holiday. That's different.
That's an amendment.
That's an amendment, right? That's a proactive. This is about people that are disorganised, handling those patients that are unorganised, that actually don't care. They don't care about you. They don't care about your white space. And they're just going to cancel. And cancelling appointments at the last minute is often a culture in practices that is ruining dental practices, ruining their production, ruining their cash flow. We help with this, of course. But one of the things is, first of all, just stopping using that word.
Yeah.
When a patient says, I want to cancel, I can certainly amend that appointment for you. When you're calling up to fill a gap, you're not saying we've had a cancellation, do you want to come in? Because what that is saying is, well, this isn't important to someone else, but would you like to make it important to you? And often it's a no. So it's an opportunity. We've got an opportunity to bring your appointment forward. Would you like to take that?
Makes it exclusive.
Absolutely. So it's much more professional language, but getting rid of that word, absolutely. For reception team, that is one of the biggest words for them to stop using and change. Yeah.
Definitely.
Last thing I'll add into it while we're on it is we don't have a cancellation list. We have a priority list.
We do indeed. Well, I think one of the things with the priority list, first of all, you have to have one and call it a priority list, not a cancellation list. Just showing the patient that you are a priority to us, which everybody wants that feeling, don't they? They want to feel great about themselves and that they're thought of and considered. But what I found in my last practice, it wasn't managed correctly.
All right.
And our front of house person was amazing. She's a wonderful girl. And she was saying everything apart from at the end of the explanation, does that work for you? And actually, when you explain the priority list to people, I'll be on that. Fantastic. But they don't actually meet the criteria to be on the list. No. They are rang. And then, oh, no, I'm working today. Oh, no, I'm doing this today. And then it becomes we're chasing. And that is a working harder, not smarter situation. And the list gets longer and longer. And then it's an absolute mammoth task for the poor people on front desk that have to manage it. Absolutely. So I do think that we need to work around, work on our language around it and actually be quite fierce with it. Because if you let any and everybody on it, then how are you then going to be able to tackle that?
Yeah, it's so simple. We can. So your next appointment is going to be in 8 weeks' time. I can also put you on a priority list, and if an opportunity arises, we can bring your appointment forward. Are you available at short notice?
Oh, I'm not actually.
Okay.
Maybe on a Wednesday.
Okay, I can make a note for a Wednesday. But it really is suitable. The priority list is most suitable for people who are available at short notice. I'm talking, 3-4 hours notice.
Oh, okay. Oh, no, don't worry then, because I normally do fill my days, with admin stuff, and it probably wouldn't work for me.
No. And that's what we need to do.
That's what we need to do.
I am not available at short notice.
No.
The type of person I am, though, is I'm I pride myself on being a really great customer to my beauticians. That if I know I can come in one day, I email in the morning just to let you know if you have a cancellation. I'm your girl.
You don't say cancellation, you say opportunity.
There's any opportunity to book me in, I'd really appreciate it. Of course, that's what I say. And do you know what? Lo and behold, they do have people cancel at short notice, but they're so busy, they fill those spaces.
Right.
And sometimes I'm there waiting in the wings for one, and I'm like, yeah, book me in. I recently came across a couple of videos on TikTok where this guy is running through a list of co-worker nicknames, and it was so funny. So I've gone on to the internet and I have found a list myself on WikiHow if you want to go in and have a look. And they are so funny. So I'm gonna go for a couple. Leanna, I think we should do a couple each and then keep this going on each pod, just because they're so funny. Okay, blister. Someone who appears when the work is done and takes the credit. I love that. That is fantastic.
Can you think of a blister though?
I think we've all worked with a blister. Deck chair. Someone who folds under pressure. Go
That's
on.
not you.
It's not me.
No. Dr. Dolittle. Someone who does very little at work.
Absolutely. All work with one of those.
Yeah,
Yep.
I like that one. Oh, E.T.
Yep.
Someone who always wants to go home. That's so good. I've got such the person in my mind that stands out for that one.
Uh-huh.
Always wants to go home.
Oh, such a drain, aren't they?
Drain, annoying.
Such a drain. They were fantastic. Let's add a couple more in to each pod as we go.
Yeah.
They're so funny. And as I say, this is just on WikiHow. And also, if you've got any funny ones, please drop them into the comments, because we would just love to keep reading them out from your comments too.
Okay, so first episode, we're going to kick off with our own confessions.
We sure are. And I'm going to start by sharing a confession of a practice manager.
Okay, go for it.
I once had a candidate for an interview and I had to threaten to call the police while she was there. She refused to leave the building after her interview. So, backstory.
It's just because I'm imagining you.
Backstory is that I was recruiting, I was interviewing. And I don't know what had happened, but this agency, I won't mention them, had sent through a CV to Jay, who was our finance manager. Jay is like the nicest person in the world that you could ever wish to meet. Aww. So he looked at this CV and went, oh, this person sounds lovely. I can see in Laura's diary she's interviewing later, and book this person in at the end of the interviews. So our system for interview one is meet and greet. I'd always do them at the end of the day so the team could sit, in the patient lounge. And, oh, hi, I'm Cheryl. How are you? How are you feeling about your interview? Because for me, if the team weren't going to gel with someone, they weren't moving forward anyway.
Agreed.
Doesn't matter how amazing I think they are. If the team are like, ooh, then I'm going with the team.
Yeah.
So that part was really important. I'd then bring them in and I'd interview them, and I'm very, very nice, let me reassure you, right? And I would say, so tell me what you know about us. Now, I'm going back in time 20 odd years or so, maybe 18 years was around the time there was the internet. It might have made a noise when you ding, ding, right? But the internet was available. We had a website, most people had internet, I would say, 18 years ago.
Yeah.
And I would say, what do you know about us? And I personally felt at this time, if you were going for a job, you would find access to the internet and investigate the place you were going to. So if someone went, I don't know, not a lot really. Bam, they're out.
They're gone.
So part 3 is I would bring the person back out and one of the team would give them a tour, which would finish at the door.
Okay.
So that's
it's
the
lovely,
system.
by the way.
Yeah, whether I'm keen on them or not, that's the system.
Yeah.
So interview on, short, sweet, people are nervous. I would cover the basics, okay? What we're looking for, what do you know about us, what you're looking for, have you got any questions? I'd cover the pay, expectations, da-da-da-da. So this lady came in. No, let me rewind. When I saw her CV, I said to Jay, are you actually kidding me? And he said, oh, but, Laura, I've said she can come in. And I was like, firstly, she lives too far away. Secondly, this CV is like, no, it's a no. I can't remember why, because it's 18 years ago.
Yeah.
But for me, it was a CV I would have deleted, put in the shredder, that
Yeah.
kind of thing. Okay. So this lady arrives. She's the last person. And I just remember, I can't remember who it was, but one of the 3 team members coming into me, shutting the door behind them and going, oh my gosh. And I was like, what?
Oh,
And they were like, she's not for us. And I was like, okay, look, thank you for sharing that with me, but I'm going to interview her and then we'll do the tour and we'll go from there. This interview was like, I couldn't believe, I didn't even know what was going on. Very, very odd. And this lady then had her tour and she got to the end, and I distinctly remember who it was that got to the door with her, and she was refusing to leave. So this team member came in to me and said, Laura, she's refusing to leave. And I was like, what? She said, yeah, she's refusing to leave until she gets a full and proper interview. And I said, well, she's had the same interview as everyone else. And she said, yeah, I've told her that this is our interview, like our first interview's much, this is our first interview. I mean, they're still there, like 25 minutes. That's long enough. If you're dating someone, in 60 seconds on that date whether you want to run or stay.
Lovely comparison.
So it's pretty much the same for interviewing, I feel. I've got quite a good feel for people. So anyway, this woman refused to leave. So this team member went and said to her, no, that is definitely it. Goodbye. She said, I'm not going. By this point, it's our end of day. Everyone wants to leave on time. And I then had to come out and I said, excuse me, is there a problem here? And she said, yes, I want a full and proper interview. You've not interviewed me properly. I've travelled all this way, and all this. And I said, okay, first of all, let's just get one thing straight. Due to your behaviour right now, you will not be getting a second interview.
Right.
I said, you need to leave this practice. We are all going home. My team have worked a very long day. If I was thinking of inviting you back in, I'm certainly not now due to your behaviour, and you need to leave. And she kept refusing to leave until I was like, what am I going to do here?
What's happening here?
Yeah, it was horrendous. And then I was like, right, if you're refusing to leave, you leave me no choice but to call the police. I said, I will call the police because this is private property and you're not welcome here anymore. I said, so if you want me to call the police to escort you 1 foot out the door, then that is what I will do.
Wow.
And at that point, I said, I'm deadly serious and the police station's around the corner. And then she left. And
what was her thought process?
I don't know, but what I can tell you was that we didn't all even laugh at this point.
No.
Because we were all shell-shocked. So we didn't know what we'd all just experienced was just beyond us. But it is something we then laughed about, sort of 10 to 15 minutes later when your adrenaline settled down and you're like, what was that? Yeah, so I had to threaten to call the police to get her to leave the building.
So strange.
And for her to think that I'd want to second stage interview her.
But
absolutely not.
That's what I'm confused of. So she's demanding more time from you, but what everybody's main aim in an interview to do is to impress.
Yeah.
Well,
it was
I don't know what
horrendous.
she was trying to achieve.
Well,
who knows?
She didn't get the job.
No, well, there you go then.
And I did, have strong words with Jay.
Did you?
Oh, yeah. And the agency the next day, I tell you what. I was like, don't ever send me someone like that again.
You're no messing.
Like,
Love
that
it.
is absolutely beyond a joke. And as an agency, sort her CV out for her.
Yeah. Yeah, lovely.
Oh, her CV was awful.
But I don't think they probably want her now after that
Who knows?
event.
Who knows?
So this is Confessions of a TCO. When I first started TCO, I shared the role with another girl in my practice. And she was kind of in and out of like, maybe I enjoy it, maybe I don't. She's really intelligent, very clinical minded. So loved that part of it. But maybe too much and didn't love the small talk. She was in and out, depended like how she felt. So she decided, and we decided to template our notes. So because she templated the free consultation notes, she automatically put her initials. Seen today, patient arrived on time, seen today by AC. And obviously I'm LB. So that was how we just, I had to physically delete and put my initials in. So anyway, whoever I saw, we then went to meet and greet them, do the handover for the comprehensive assessment, and we would support the patient that we've obviously spoken to. So we worked out the diary, and the diary zoning was amazing. I mean, this clinic was seamless, well-oiled machine until... So she comes upstairs. She said, I think we've made a mistake. And I was in decon. I was like, what do you mean? She said, I'm just looking at that patient downstairs and I don't recognise him. And I was like, all right, well, I'll come down. Obviously, I'll walk past or I'll go in to reception, grab something, have a look. So I go into front desk area, have a look, like, trying to work out which patient it was. And because nobody sort of I didn't notice anyone. I thought, okay, well, no, definitely don't reckon. And I've got a great memory at this point, maybe not so much now. Anyway, so I go out, I said, no, definitely don't think I saw that patient and that's that in the waiting area. She went, are you sure? Because I don't recognise the way the notes are written and I don't recognise the patient. I said, well, look, it's you. You've obviously forgotten. And at this stage, right, I remember a lot. She doesn't remember a lot. It's fine. So she goes in and obviously we initially go in as a TCO, support with the nurse. We do the photographs and get everything ready for the handover with Neil. So she goes in, she welcomes the patient and is doing the, obviously the photographs, gets to the handover part. So Neil comes in, they obviously exchange some, hi, how are you, do the handover. But when she's doing the handover, she's going, so I met patient name and, really we had a really good conversation about how he's now in uni. The patient's looking at her going, what? She said I could see on his face he was thinking, what are you talking about? I don't know you. So she's going with it. She's really invested in the story. And she's like, yeah, we had such a great time. And, explained to me about how he's settling into Bristol. And she is in actress mode, right? Neil's obviously Neil. He's like, yeah, brilliant. Takes off. Fine. So the patient keeps looking at her and he's like, you're a bit strange. And she then knew, right, that's it. Leanna's, I'm in for it, basically, me. So then I get radioed through because we were wearing radios at this point, and it was like, oh, Leanna, are you free to take an X-ray? I was like, yeah, of course I can. So I go downstairs and she's explaining the OPG to this patient. And I go down and I'm like, hi. And he's like, you're the one I saw, not you. And I was like, oh, yeah, nice to meet you again. Obviously, I didn't know who he was. No clue who he was. Ashley was like, see, I told you. But then I literally could not get past it. I did the X-ray image, ran into the stereo room and was laughing for ages. So much so that Kat that was in there doing instruments was like, I'm laughing with you, but I don't know what you're laughing at. And then obviously I told her the story. Horrendous.
That is bad.
Bad.
Now that's because you also shared a TCO diary then, I'm guessing.
Yeah.
Yeah.
Brilliant story, but obviously he was great. Like, he was a really good sport about it. And then I was like, should we tell Neil? Should we tell Neil? And she was like, well, we're going to have to. Because what about if the patient complains? And I was like, oh, God.
Oh, no, this is now turning into,
like, worry, And I went and I said, well, look, Neil, I've made a mistake, when you go in really firm because you're worried about the reaction. And he was like, oh, it's okay, fine. And I was like, oh, fine then. Okay.
Yeah, just work that up to absolutely nothing in my mind.
Yeah, because I'm downstairs really hyping myself up. I'm going to go in, I'm just going to tell him.
Yeah. Yeah.
It's not my fault.
Owning this mistake.
I'm owning it.
Yeah.
Because I don't like to have things hanging over me.
Mm-mm.
Anyway, he was like, oh, never mind. Things happen. I was like, oh, fine then. Brilliant. Thanks for that.
Thanks, Neil.
Yeah. So, yeah, moral of the story, different diaries. Have separate templated notes. Don't share them and delete things out because when you're in a rush, things get missed.
Sounds like your notes were fantastic, though.
Oh, they were lovely notes because she knew him. Yes, we met last time and he's really enjoying his new course in uni. And he was like, what? Am I with you? I'm not sure I met you, love. It's so good. That's my favourite. That's one of my favourite funny stories.
That is brilliant, yeah. That's a brilliant day. Fantastic. First question in for the Horton Hangout podcast 1 is, how should we best juggle part-time staff and in particular accommodating days after mat leave? This is such a big topic and also a big thing for our profession based on the fact that the majority of the profession are female.
Correct.
Even the stats now for dentists for the last few years, there are more female dentists than male dentists. And as we know, as a DCP group, that is,
female dominant.
Absolutely, without a doubt. Right. So I think one of the things that is always a problem in practice is that as a whole in dentistry, we're a caring profession. We're nice people and everyone's too nice. So we're nice to our colleagues. We're nice to our patients. One of the reasons that things go wrong in practice from a front desk perspective is we bend over backwards for our patients because everyone's too nice. And I'm always telling practices, stop being so nice.
Yeah.
And this is it again. We've got a team member who's been on maternity leave. They want to come back. They're changing their hours from full-time to part-time. And they're then telling us when they can come back in, and that's not how it works. So the practices really need to be on the front foot with this here and leading these conversations around the relevant timeframes to get an understanding of, are you coming back full time? No, I'm not. Okay, we have these days available.
Exactly, because it is very much hush hush, let's not upset the apple cart, we'll let them contact us, there's no leading it. And that's the biggest issue. It's a worry, isn't it? They don't want to offend somebody. The pregnancy itself can be an emotional time for a woman. And then obviously we both know how it feels to have a baby and the emotional roller coaster after that. And especially if you've got a tough baby, you can only imagine you're in the trenches. But I think it's facts. You have to lead it. You have to understand what's happening for your business. It's not being unkind, it's being proactive.
One of the problems also that we have with maternity is the team member coming back dictating when they're going to come back and how many days, and then we're scrabbling around trying to make that work when that's not how it should be. But the other thing that I know I'm really opinionated on,
Go on.
and some people don't like me for it, but people that want to come back 1 day a week, particularly as a dental nurse, for me, that's an absolute no. 1 day a week does not work. This isn't a hobby. This isn't a social event. You don't come here 1 day a week. No. There's no way, particularly after even a 9 or 12-month maternity, and we can maybe talk about that another day, that people can remember and settle back in. It's like inducting again, isn't it? And 1 day a week for me is an absolute no. And I would also go as far as saying that I think it's really difficult to be back in practice even 2 days a week as a role that requires a lot of attention and a role that has a lot of responsibility. So where that may work for reception in some cases, depending on how you carry out, what's the job description of that receptionist. But for high-level nurses and TCOs to come back 2 days a week, for me, it's an absolute no, it doesn't work. What are your thoughts around this? Because if I remember, you went back 3 days, is that right?
Yes, I went back 3 days. And it was fine because I had the young lady that was supporting my role when I was gone. So I trained her before I left. She was amazing. But then she got into uni. So she quite quickly left when I came back. And then it was down to me on my own 3 days a week, juggling a full-time TCO role. And that's when things got really tricky. So it doesn't really work if you're on your own. If you've got support, absolutely. And support can be different because what we ended up doing was trying to recruit another TCO. That was going to be full-time. And then I was going to be, doing what I do with the 3 days because we needed the manpower basically. But we were really struggling. Nobody was really cutting the mustard. And then eventually somebody did come in and we absolutely loved her. I still like her now. I still seen her the other week, actually, because she lives near me. And she came in, but she needed school hours. And we always remember what you said. If you think somebody's worth it, make a role for them, basically. And we did. So she became my TCO admin. And we worked really closely together because we were together on my 3 days the whole time I was there. And that worked wonderfully well for us. But I will say, I think that worked well because of the team and the system that we already have in place. If they're not there, then I don't think it can work.
I would find it really stressful, and some people can probably deal with this stress, but I would find it really stressful only being in a practice for a number of hours a day if the practice is open for more hours than what I'm in for.
Mm-hmm.
So, for example, working in my practice on a Friday, I really like it. It's a shorter day, which isn't the reason I like it, but I really like it because it's got a lot of momentum around it.
Yeah.
And it is a more leveled up day. It flies by. I've got to be so slick, so organised when I'm being a TCO that day.
Mm-hmm.
But I love it.
Mm-hmm.
But everyone else is doing the same hours.
Mm-hmm.
If I was just doing those hours and flying off, I'd find that quite stressful. But that's me.
Mm-hmm.
Again, we've got to appreciate everyone's different.
Mm-hmm.
But I think back to this maternity leave and managing part-time staff is always going to be an issue in dentistry. It's always going to be an issue.
Mm-hmm.
But the practices have got to lead it,
Mm-hmm.
not be dictated to.
No.
Because if the hours don't work and someone's changing their hours, that's not on you, that's on them.
Mm-hmm.
You've got those hours. You're following the legal requirements of reinducting someone after a maternity leave,
Yeah.
which is your hours are protected, your hours are safe. And if you're not going to come back to those hours, then it's for the practice to tell
Yeah.
that person what hours they have for them. And if that doesn't work, then you need to go and recruit.
Yeah. Definitely.
And sometimes that's a shame, and I get it.
Yeah.
But if you handle it professionally and handle it well, that person may come back to you in the future for another role
Yeah.
because you've handled it all so well.
Yeah, exactly that. And just going back to what you said a minute ago about having a specific role within a dental practice and only being there part-time, and the memory and how much you need to retain, it is really difficult. It is really difficult. I think that's something that you need to be very open and honest about. Do you think this role is going to suit those hours?
Mm-hmm.
Because TCO role is intense.
Mm-hmm.
There's a lot that goes into it, obviously, if you do it towards your method.
Mm-hmm.
And you do need to be able to support everybody, and the patients.
Mm.
What about if I speak to somebody on the Monday and they want to speak to me on the Wednesday, but I'm not in?
Mm-hmm.
Then the whole experience starts to fall away.
Mm-hmm. And also, I'm sure you're happy to share this, that after you had your second child,
Yeah.
you really were limited to 2 days a week then. And that then didn't work.
Didn't work for them, no. But it was comfortable. I'd done keeping in touch days. I think we were both in, because I'd already had a child and they knew that I was, my intentions were to go back. When I then said, I can only do 2 days now, I think we were both a little bit gutted, really, because it wasn't supposed to be necessarily the end of my journey, but it was the end of my journey based on the fact that they needed more. And I do get it. So there's no sort of negativity from my end at all, because it just wasn't right anymore. And I mean, I'm sure they're thriving still anyway with the TCO they've got now. So I think it was the best decision.
Yeah.
And like you say, when you handle it correctly, there's no reason for it to be anything negative or uncomfortable.
Yeah, exactly. All I'll say on that is their loss, my gain.
Yes. That is.
That's it for pod 1. We look forward to seeing you back here next week. If you haven't already, do follow. And if you're feeling kind as you work in dentistry, why not give us a 5-star review?